Hi, my name is Arthur Dinkel, M-A-M-S-W. Are you tired of all the bullshit therapists that are trying to tell you things, mostly that, you know, the ones that sit back and they hold all the secrets of the world in their hands. They sit back with their hands crossed, and then they whisper in a nice soft voice to you, well, how does that feel? How does that feel? Well, Dr. Phil, not. TV therapist, not. Sorry about that. And do I have all the answers? No, not at all. I don't have a little therapist manual that tells me what to do or what's wrong with you or anything. I treat the person with the problem. I don't treat the problem. Okay? I deal with intimacy problems, sexual functioning, addictive disorders, loneliness, shyness. I mean, ask a therapist, one of these therapists that you see about intimacy. They probably couldn't even tell you, one of these guys, what intimacy even is. You're paying somebody $200 an hour, and they couldn't even explain it to you. Or they use these scientific psychobabble words that are used more to hide than to disclose anything. Because they know normal people, regular people who aren't in the profession don't even know what they mean. A lot of them write books, many books on therapy, on self-help and all. They have books written about relationships. They don't tell you they've been married 5 or 6 times. I even had a patient one time. He told me he never ever cheated on his wife. This is a true story. But yes, he was married 11 times. So instead of cheating, he just gets divorced and goes and finds another woman. Well, what I use is a thing called IST, which is just a fancy name, Integrated Self-Actualization Therapy. What it comes down to, it's it's basically cognitive behavioral therapy. And what that is if you change the way that you think, you're going to eventually change the way that you feel. So by talking to yourself differently, you're going to wind up feeling differently. A long time ago, about 50 AD, there was a Roman philosopher, Epictetus. He wrote a little book, The Enchiridion, and he said it's not the events in life that cause us problems. It's how we think about those events or acts in life. And that's the essence of what this type of therapy is about. Okay, I'll give you a small example. This happens to be one of my favorites, but it's old hat. Anyway, if you're on the 87th floor of an elevator, somebody keeps poking you in the back. Well, how do you start to feel? You start to get pissed off. You start thinking to yourself and talking to yourself. That's self-talk. And you start saying, well, this son of a bitch, he's poking me in the back. What's he, so egocentric, so selfish? He just cares about himself, nobody else around him, like he's in his own world. You know, like some of those people that go up the escalator in a store, and when they stop at the top of the store, at the top of the escalator, they all of a sudden they just stop and look around like there's nobody in back of them. It's the same type of thing. So you're thinking to yourself, this guy on the elevator, he's poking me in back. You're on the 87th floor going down, you're getting more and more pissed off. You get all the way downstairs into the lobby, the door opens, you're going to turn around and give this guy a piece of your mind or whatever you want to give him a piece of anyway. You see that the guy's blind. Well, now how do you feel? Well, all of a sudden, maybe you feel empathy, maybe you feel guilty for what you were thinking. Say, you know, this poor guy, you know, he's disabled, he's not even as well off as I am, all this. The feelings have changed. And why did the feelings change? The act certainly didn't. You still got poked in the back for 87 floors. So it's not the act that caused the feelings. It's the way you thought about getting poked in the back. One time you thought the guy was being arrogant and rude. The other time you thought he couldn't help it because he was blind. So it's the same way in therapy. Many of the things that you think, and if impact on the way that you feel. So by changing your thoughts, you do change the way you feel. I could show you how to go through all of this, to deal with loneliness, to deal with your shyness, to deal with intimacy problems, how to meet people, the difference between love and intimacy, love and limerence, which is infatuation. All of these things can be changed. You could learn how to have mind-blowing sex. You could be the person that you want to be instead of the person that you wound up becoming because of your environment. A lot of people, it's not a toxic family that people come from. It's a shitty childhood, perhaps. It's environmental variables that have impacted on you, that have helped create the person that you are, no matter what age you are. So rather than staying with that person that you become, you do have the ability to become whatever you want to. But you need guidance. You need life coaching in order to change that, in order to change yourself to become the person that you want to become. If you go to my website, Theeadvisor.com, you could read my bio. I'm a past professor. I've had large private practices, and I could show you a lot of these different things. And I will be having other YouTube videos as well on sexual functioning, on love, the difference between love and infatuation or limerence, on addictive disorders. A lot of therapists talk about addiction like it's you're addicted to food, you're addicted to sex. That's just a cop-out a lot of times. I don't know if anybody, can you be addicted to something that you really need, that your body needs? Can you be addicted to that? I think not. Anyway, we can get into a lot of different things. Wow. Okay, you better cut it off. Huh? I feel better just doing that, though.
Yeah, of course.
Hit the button.